Hi, I'm Rick Dancer, and we're here with Dr. David Freifeld, a radiation oncologist at the Willamette Valley Cancer Institute. And you're probably on this website because you just found out you have cancer, you have prostate cancer, and you're wondering what to do. And I think this is very important for people to hear this story right here about active surveillance as one of the first options to look at with their oncologist and their doctor and so forth.
Well, hopefully if you're watching this, you're interested in getting some more information. And that is an important thing. Just take a step back, take a breath, and find out what the options are. Active surveillance is a very good option for some men with prostate cancer.
And that's the hard part for a man when he finds out. When I found out I had prostate cancer in 2010, I didn't panic, but there was a side of me that said, oh my gosh, the C word. I now have the C word over my head, and I've got to do something.
Fear is a big part of that. And there's a sense that, well, we're sitting here talking, the cancer could be growing. People say that to me all the time, and the answer is no, that's not what it does. The truth is cancer has been there for probably years before it's discovered. Really? So you have a few days, you have a few weeks, some guys even take a couple of months. And I think that it's wise to take the time that is necessary to investigate the options and make a wise decision.
Because prostate cancer is the slowest growing cancer, so it's highly treatable.
Yeah. Oh, it is. It is, and it turns out that some fellows don't even need treatment for their prostate cancer.
How do you know if that's you? And that's where you come into the picture. There's guidelines that are set up that you guys use.
Oh, there are guidelines, yes, absolutely. And so we look at the PSA, we look at age, we look at the stage of the disease, and we look at what other medical factors might be there, heart disease, those kinds of things. And so we can tell each fellow what category of risk he would be in. And there are some fellows where active surveillance is not a good option for them, and we just tell them that. But there are others where it's very reasonable, and it's one of the things that can be considered. So yeah, it's individualized, but it requires talking to the doctor to help make that decision.
It seems like over the years, the last year or so, we've seen a lot more of active surveillance, because before it was really get in there and take care of this thing now. And we've learned a lot, haven't we, about treating prostate cancer?
More and more studies have come out, and there was one even coming out today that said there are an awful lot of fellows who are treated for prostate cancer who never really benefit from their treatment. Now, that's not because anybody did anything wrong, it's just because you couldn't tell whether their prostate cancer was going to need to be slow growing or not. And that's where the idea of active surveillance comes in. It's not the same as not doing anything.
So if I have active surveillance, what does that consist of? I come to you and you say, Rick, I think we can wait on this. So what do we do? 6 months, what happens? A year, what happens?
Yeah, so that's what you do. You check the PSA at the time of diagnosis.
Just a blood test?
Yes, easy blood test to do. And then you check it again at about 6 months and at 1 year, and you see how fast that's changing. And you also repeat a biopsy at 1 year, and you see whether the cancer looks more aggressive under the microscope. And you use that information to help determine whether the cancer is active enough that treatment should be initiated.
So part of not moving too quickly is really doing your homework and your research and getting other opinions, second, third, fourth, finding a team of people like you have here at the Willamette Valley Cancer Institute to really lay out all the options, not just one or two.
That's exactly right. Prostate cancer, there are a lot of options. There's a lot of different kinds of treatments. It can be overwhelming to try to sort through all of those. And so, yeah, the first step is take a breath, step back, and then the next is get some information. You need to be an active partner in your care and in the decisions that are made. So it doesn't really matter what your brother-in-law did or one of your golfing buddies. You need to talk with different doctors. You need to talk with a surgeon, you need to talk with a radiation oncologist. Maybe you need to talk to more than one of those specialists. And you need to read, you need to go on the internet to reputable sites and get information that is going to help each fellow make the decision that is right for him.
And that's one of the nice things you guys really do offer here is you have this team of folks with many different treatments. So you're not as limited with your options. And I'll tell you, any guy watching this now wants as many options as he can have.
I really like talking to fellows with prostate cancer. They come in with their families, and they typically are confused. There's so many options. They've read some things. They just kind of don't know how to make sense of all this. And I like to sit down with them, and I like to talk with them about their disease, about their risk category, about the treatments that would be appropriate for them as an individual. and then help sort through the pros and cons of each of those, including active surveillance, and ultimately get them to the point where they can make a really good decision. Now, I'm a radiation oncologist, and sometimes they choose radiation, but sometimes they choose something else. The important thing here is not which treatment they choose, but that they feel really good about the decision that they make.
And that they really looked into it so that they feel, I think that was part of the buy-in for me, is once I figured it out, you feel so much better.
You do, and you're going to have a better outcome, you're going to heal faster. That's what's important. It's not the particular treatment, it's that you feel the best you can about that.
You said something in your office when we were talking, and I think we should address that, is with family. A lot of family, it's hard to convince to go ahead with active waiting and active surveillance and holding on a little bit here.
Right. Well, the fellow is concerned, maybe even a little bit fearful about that cancer, but so is the family. And they all want the very best, of course, for their loved one. And a lot of them are pushing for treatment as well. But we also need to think about side effects, because any treatment for cancer comes with some degree of side effects. That's just the way it goes. So I think that you need to be wise when you choose treatment and when you wait.
And the side effects most gentlemen out there are going to be most nervous about is losing their ability to achieve an erection, and any treatment can bring that on.
It can. Yeah, unfortunately, that is one of the side effects that goes along with prostate cancer treatment. It doesn't happen to every fellow. It also depends on the type of treatment, how aggressive it needs to be. It depends on the age of that fellow and whether he's a smoker or not, quite honestly. But you know, yeah, those are things that I think most men are concerned about, but also is something that they should discuss with their doctor.
Now, you were saying something earlier too about, I think, and I resonated with this when we were talking, is that I want my life to be like it used to be. I want to take care of the cancer so that I can be the guy that I was before I walked into your office and you said, Rick, you have cancer. So that's not really going to happen, is it? This is a new reality.
I hate to be the bearer of bad news, but when you get the diagnosis of cancer, things change. Right. And there isn't anything you're really going to do to go back to the way it was, to the pre-cancer days.
But the good news is,
whether you have surgery, whether you have radiation, you are changed forevermore. Now, not physically necessarily, but there's always that possibility of cancer that's in the back of your mind. And that's one of the challenges. Now, people deal with that, and people have even told me that their life is richer, right, and they appreciate things better, and they have a better sense of what's important and what's not important. So you do hear that from people. But no, we don't go back to the way it was. We have to move forward and just make the best decisions, but can't turn the clock back.
All right. Dr. Freifeld, thank you so much for talking with us. If you want more information, go to the website that you see right there on your screen, and there's more conversations about other kinds of treatments as well.